augment one another so that there is development of severe excruciating type of pain. Now, often the pain from the spasmic viscera occurs in the form of cramps. What is this cramps? That the pain comes and goes, that the pain increases to a high degree of severity and then it subsides. Then again it comes and go to high degree of severity and then subsides. Now this process continues intermittently once every few minutes. The intermittent cycles result from periods of contraction of smooth muscle. For instance, each time a peristaltic wave travels along an overly excitable spastic gut, a cramp occurs. The cramping type of pain frequently occurs in conditions like appendicitis, gastroenteritis, constipation, menstruation, parturition, that is delivery of a baby, gallbladder disease, or ureteral obstruction. So if the scenario comes to you that a patient comes with a history that there is a sort of pain in the abdomen which comes and goes, so this is actually going to give you the idea that this is a crampy sort of pain which is coming from a hollow type of viscera. So we are going to ask the areas and then we are going to further history taking is going to help us to get to the right answer. Now, overdistension of a hollow viscus. Now, let's talk about that if a hollow viscera is actually overfilled, it is overburdened, there is overstretching of the tissue themselves, and this overdistension is going to collapse the blood vessels which are there in its wall. Or you can say that the blood vessels which are actually encircling the viscera or that pass into its wall, thus perhaps promoting the ischemic sort of pain. Because the collapse of the blood vessels is leading to the ischemia, or you can say that decrease in the blood supply to that particular organ. Then we should be knowing about that we do have insensitive viscera. Now in our body there are some of the visceral areas which are completely insensitive to pain of any type, and they are like the parenchyma of liver, the alveoli of lungs. Yet the liver capsule is extremely sensitive to trauma, to stretch. Bile ducts, they are very sensitive. In the lungs, the alveoli are insensitive, but the bronchi, the parietal pleura, they are very, very sensitive to pain. So if you are being asked that what are the viscera which are actually completely insensitive to this pain, they are actually the liver parenchyma and the alveoli of the lungs. Now let's talk about this term parietal pain. When a disease affects a viscera, the disease process often spreads to parietal peritoneum, pleura, or pericardium. So these parietal surfaces like skin, they are being supplied by extensive pain innervation from the peripheral nerves. So they are going to give us the idea what is actually the exact pathology, where is exact the so this parietal pain is actually giving us the idea that what is the exact area of damage which is actually resulting in this pain. Therefore, the pain from the parietal wall overlying a viscera is frequently sharp. It is frequently sharp because it is extremely and it is quite well innervated by the free nerve endings of A delta fibers type. An example like that between this pain and true visceral pain is a knife incision through parietal peritoneum is very painful. Therefore, a similar type of cut via the visceral peritoneum or through a gut wall is not very painful, if painful at all. So, we should be knowing about that it is actually the type of fibers over there which are actually going to determine that which type of pain is to be sensed by that area. If there is presence of A delta type of fibers, sharp lancinating type of pain that is being perceived. If there is presence of C type of fibers, then there is a sort of dull, ache, continuous type of pain that is going to be perceived. And if there is no nerve fibers, no free nerve endings over there at all, there is no pain perception from that particular area. So, we should be able to demarcate that the perception of pain is actually very much dependent upon the type of nerve fibers over there, the number of nerve fibers over there, as well as the area which is actually being perceived. So now let's talk about the localization of visceral pain, the visceral and parietal pain transmission pathways. Now, pain from different viscera is frequently difficult to localize for a number of reasons. For example, if the patient's brain does not know from first-hand experience that the different internal organs exist, therefore any pain that originates internally can be localized only generally. Actually, it is our brain which is knowing the exact location of those viscera, so that's why we are able to tell that we are having pain in that area. So otherwise, if we are not knowing the exact location, then only a general feeling of pain will be there. Sensations from abdomen and thorax are being transmitted through two pathways to the central nervous system, that is the true visceral pathway as well as the parietal pathway. Now the true visceral pain is transmitted via pain sensory fibers within the autonomic nerve bundles, and the sensations are referred to surface areas of the body often far from the painful organ. Conversely, parietal sensations are conducted directly into local spinal nerves from the parietal areas of peritoneum, pleura, pericardium, and they are usually localized directly over the painful areas. So we should be knowing about the difference between these visceral pain sensations and parietal sensations. Visceral pains, they are actually not exactly on the location perceived, whereas the parietal sensations, they are actually highly localized type of pains, because they are actually conducted directly into the local spinal nerves. Now, localization of referred pain transmitted via visceral pathways. Now, when the visceral pain is referred to the surface of body, the person generally localizes it in the dermatomal segment from which the visceral organ originated in the embryo, not necessarily where the visceral organ now goes away. So, at the time of origin, if that particular area, like let's talk about the left arm, left shoulder, the skin, they have the same dermatomal origin as that of the heart. So that's why when the person grows up, it goes the different organs, they have gone away from one another, but their origin, dermatomal origin, was the same. So that's why they are feeling the pain at the same time. Again, the heart, which is originated in the neck and upper thorax, so the heart's visceral pain fibers, they pass upward along the sympathetic sensory nerves and enter the spinal cord between the segments of cervical 3 and thoracic 5. Pain from the heart is referred to the side of the neck, over shoulder, over pectoral muscles, down the arm, and into the substernal area of upper chest. These are the areas of body surface that send their own somatosensory nerve fibers into C3 to T5 cord segments. Most frequently, the pain is on the left side rather than on the right side because the left side of the heart is much more frequently involved in the coronary disease than the right. Um, you can see that these are actually the areas of different viscera, and these are actually the areas where the pain they are being felt. If that is of heart, over that side, stomach, liver, gallbladder, pylorus, umbilical region, appendix, um, small gut, kidneys, colon, ureter. So these are actually the different areas which are actually showing the areas where the pain, the visceral pain that is actually being perceived if the damage to these particular organs actually occur. So all of you should be knowing these areas. You are supposed to make the diagram in your logbook. The stomach, which is originated approximately from 7th to 9th thoracic segments of the embryo. Therefore, the stomach pain is referred to anterior epigastrium, above umbilicus, which is the surface area of body which is being served by 7th to 9th thoracic segments. Now, there are several other surface areas to which visceral pain is referred from other organs, representing in general the area in embryo from which the respective organs originated. Now let's talk about the parietal pathway for transmission of abdominal and thoracic pain. You can see how this visceral pain that is going and how this parietal pain is going. Pain from the viscera is frequently localized to two surface areas of the body at the same time because of the dual transmission of the pain through the referred visceral pathway and direct parietal pathway. Pain impulses they pass first from appendix through visceral pain fibers located within sympathetic nerve bundles and then into spinal cord at about T10 or T11, and this pain is referred to an area around the umbilicus and is of cramping, dull, aching type of pain. So you should be keeping this term appendicitis and umbilical region to your mind for scenario. Now pain impulses also often originate in the parietal peritoneum where the inflamed appendix touches or is adherent to abdominal wall. So it is going to lead to sharp type of pain which is directly over the irritated peritoneum in the right lower quadrant of abdomen. So you can say that right at the same time the person is feeling the dull aching type of pain over there in the area of umbilicus and the sharp lancinating type of pain over there in the right lower quadrant of abdomen. So these two are actually going to augment one another and is going to make the person to realize that something wrong has happened and he or she should immediately go to the hospital. So this is how we can say that pain is a protective mechanism. It is protecting a person from some harmful insult to the tissue inside or outside our body. So, this lecture is quite important because some scenarios related to appendicitis, related to the cardiac pain, cardiac ischemic pain, they can come or they are coming most of the times in the university examination. So thank you very much and stay blessed. Allah Hafiz.